been here for the last 11 months. Thank you for being here. And we have kind of the final push that Congress is making, and an exciting maybe next 10 to 15 days to see if they will do something or nothing on both the federal budget and the ACA marketplace slash healthcare subsidies. So we're going to start with some states related stuff because we've had some requests for those updates as well. Last week we talked about how what the legislature promised in terms of how much schools would be paid for the special education services they've already provided. That promise was to pay school districts 42 cents for every dollar that they had already spent for special education. And when the actual costs and the actual bills were factored in, the pot of money that was set aside reduced that reimbursement from 42% to 35%, which was not only disappointing to many advocates who had worked very hard, but also a real opportunity to talk more broadly about why this mechanism that we keep using continues to not work and not really give schools the amount of money that it costs to provide special education services. And lots of you contacted your state legislators and the press. And so here are a couple of articles in major Wisconsin markets. There may have been more that came out from all of that activity. And one suggestion as you're looking for ways to engage with your state legislators, sometimes if it's good to kind of copy the whole article and paste it in an email, maybe even highlight some of the sections that you think are really important, and then put your story at the top of the email. So, it's a way for you to say, hey, here's my thoughts on this issue or how it impacts me personally. And it's not only me, it's also in these articles that you may not have seen. I think that there's so much information out there that we can no longer assume that legislators, like anybody else, are aware of all of the stories that are happening. But this is an opportunity, and another way to kind of use and amplify the work that collectively advocates are getting out into the press to help legislators understand not only how it impacts their constituents, but a much broader group of people. So just a tip as you're looking for things to schedule on your holiday calendar. The state legislature is not scheduled to meet in December. There have been some rumors that have not been confirmed that maybe they would call an extraordinary session, but that those are merely rumors, and there's no official time set on the December calendar for the state legislature to meet. And that means a couple of things. One, there are some things that the legislature actively needs to do. And specifically, it's that additional money that the Department of Health Services needs to implement the changes that are coming because of the federal bill that passed July 4th. We've talked about that several times before. It's about $70 million that they need to be able to meet the new requirements, which includes having many more people have to prove that they're working. And it includes also some reduction. So they're gaining more costs because they have to do more things at the same time that they're also losing federal dollars to run the program. So this money is really about how can we continue to do the thing, food share, and meet the new federal requirements without getting penalized as a state. And the legislature is very aware of the issue, but they have not acted on it yet. So the longer the legislature delays, the more likely it is that Wisconsin's error rates and the mistakes that are counted against the state and will end up costing the state in future years, the more likely it is that error rate goes up and the risk of the state being financially penalized for those errors also goes up. So this is a good time to again connect with the legislature and ask, where are they on this? Where are their thoughts? When is this action going to take place? Because the longer the delay occurs, the longer it takes for the department to hire the new people it needs and to get everybody trained and in place and doing that job to avoid potential penalties. This is also a great time to connect with your legislators about that special education reimbursement rate. There have been members who have been, talking about publicly that what they thought had been passed in the budget and what is actually happening on the grounds in their local districts is not what they want to see. So that is a kind of good thing to keep emphasizing for members, that it is an important issue to constituents as well. And then there are a few bills, most importantly, the Patients Representative Bill, that are somewhere in the process of either moving forward or not this legislative cycle. So it is important, if there's legislation that we've been following, that you either support or have strong feelings that it would not be a good idea. This is a great opportunity to let legislators know that now, because they are going to be making decisions in January and potentially February about what bills they're going to vote on to try and pass and what bills they're going to kind of let sit and not move forward. So we have a link there at the bottom that gives a summary of all of the things that we've been watching. And you can go there to get some talking points if you need them on those issues. There is another bill that kind of sneaked past advocates. We were aware of it and had been watching it, and it has passed both houses of the legislature and is now sitting at the governor's office. So if you've already made your contacts to your state senator and state representative about issues, you can also, here's an opportunity to contact the governor. This particular bill prohibits state or federal funding from being used to provide health care for unlawfully present individuals. And the first thing that I think about is, well, if you can't provide health care to unlawfully present individuals and get paid for it, then then everybody potentially has to prove that they are lawfully present. It's very similar to the ideas we've been talking about the last year with regard to work requirements, where you either have to prove that you are working enough or prove that you are exempt to keep your access to Medicaid, for example. This is another example, different issue, where the administrative burden is being put on the patient and the healthcare provider to prove that you are a person that is lawfully here, and therefore your healthcare costs should be reimbursed by programs that are touched by federal and state dollars. This is a pretty expansive bill, and an example of a bill where I'm not sure legislators really thought about how do you implement this idea. Survival Coalition did send a letter to the governor's office outlining concerns. There are lots of federal and state dollars that are attached to various kinds of healthcare programs. For example, Medicare is all federally funded. Medicaid is state and federally funded. Anybody who gets a subsidy on the ACA marketplace, part of that is federal funding. And the state puts in a portion of state employee costs. And that's true for counties and local school districts as well. So, people like school nurses or who work for county nursing homes or who work for our state or our nursing homes or our state institutions or the UW health system, who get their insurance through a state or local group insurance program, those are, a portion of that funding is state dollars. So it's really, the language of the bill is very broad and the bill is very short. And it does seem like all of those things, which cover a tremendous number of people in the state, would be potentially touched. Survival Coalition raised a number of concerns. One, again, in emergency situations, how is somebody going to be able to prove that they're lawfully present? And when do you need to do that in order to be able to get care? Also, in emergency situations, there may be people who are lawfully present but don't have, like, what documentation do you even need to prove that? And sometimes people are not in a state where they are able to communicate as they normally do. So there's lots of questions on how do you actually do this policy in the real world. The other thing that Survival raised is that 30% of the direct care workforce are immigrants, and many of those workers are touched by health insurance programs that are partially funded by either federal or state dollars. And recent changes at the federal level, immigration status can change. So sometimes people move from one status to another. Maybe they're moving from a green card to being a naturalized citizen, or a naturalized citizen to a citizen. And whenever changes happen, that doesn't necessarily mean the kind of document breadcrumb trail is updated everywhere. So, Survival is saying, hey, we have a high group, a group of people who are immigrants who are incredibly critical workers in this sector, and we don't want any paperwork mistakes or snafus to jeopardize their health care. There's also a concern that at the federal level, many people who are legally present now, their status may be administratively changed. And what do I mean by that? There have been populations of people who have been legally here, in some cases for many years, under certain types of statuses. One is temporary protected status, another large one is refugee status. And in recent weeks, the federal government has basically said we're removing that status. So everybody who was here legally under that status, they have become essentially de-documented. They're no longer here legally because the status they were here under has changed. And Survival was very concerned that, there are lots of workers who are in the care industry who are here legally, but if that status is changed at the federal level, then that becomes another way that people can move from lawfully present to unlawfully present, and it creates a lot of confusion for how do you even know who those folks are and administer them. So this bill is going to the governor's desk. I believe it was sent yesterday, December 4th. And that means that the governor has 6 days to decide whether to sign the bill into law or to veto that bill. And if you are concerned about this particular bill, you can certainly contact the governor's office and let them know your opinion. Also this week, there was a report released from a nonprofit group that kind of a think tank in Wisconsin. And we wanted to elevate it here because sometimes that is a strategy where a group that may have certain ideological positions or focus on certain issues, it is a strategy to release a report and try and get coverage of that report and promote a report to advance a series of policy ideas. So this is a common strategy that lots of organizations use. This particular report was focused on birth to three and the Children's Long-Term Care Term Support Program. And it really was focused on, it really was questioning why there are so many more people who are eligible for these programs and whether or not these programs are effective. So the report in itself is, kind of like when we talked about the president's budget in May, and we said, this is not necessarily something that will come to pass, but it is kind of a signal or a green light or a sign that this organization is trying to throw out of, hey, look over here, legislators. We think there could be a problem with these programs. And if you're looking at things to change or things to cut, we're going to elevate and look at these and tell you that these are programs that we think, bear a second look. Because the next budget cycle will have to deal with all of the federal funding cuts, including Medicaid, that are happening now as a result of HR 1 and as a result of other federal administrative actions. We can anticipate that legislators are going to be looking for where can they cut, where can they reduce the state budget in the next cycle. So this is a strategy to kind of highlight programs and kind of point legislators to certain places to look to make cuts first. And in the next year, we'll be talking about this in January, there will be lots of opportunity for constituents to engage with candidates, people who are running for office. Some of those may be current elected officials running again to keep their jobs, and some of them will be new people who would like to have those jobs. It will be very important at a local level to engage with candidates and help them understand disability issues, first of all, disability programs, and specifically, what do those programs really do and mean to the lives of people with disabilities and their families. And you guys had a lot of practice last spring when we did the Why Does Medicaid Matter to Me kind of exercise. I think that level of effort will be needed again throughout the next year, really, as people are running for office, because many folks who are running from office are not coming from a similar background and really aren't deeply knowledgeable about things like home and community-based long-term care, like family care and IRIS, or special education, or many of the other services and supports that people with disabilities benefit from. The other thing to note about this report, very similar to some of the language that we've heard at the federal level, is it is really framed in a way that says, hey, there's more of a presence of disability, and we think that's a sign that there's a problem. So it's a very short report, but I think advocates read through it and we found it notable that that the rise, like increased use of these programs, is being portrayed as, oh, there's a problem with our children because we think there are more people with disabilities. And particularly notable is the idea that birth to three is not effective because the people who are entering into birth to three aren't necessarily progressing and coming up to the level of their non-disabled peers through the program. Well, to get into birth to three, you have to be, not at the same level as your disabled peers or non-disabled peers. So there seems to be some expectation of these programs improving or changing somebody's disability status, which is really kind of going back to some very old ideas of can things, can you fix something? But in this case, the presence of disability and the idea that the people in those programs aren't progressing in a way that is lessening or eliminating their disability is being used to say that the programs aren't effective. Congress. This timeline keeps getting shorter because we have less and less time, but you can still see how many entries there are here. We really have about 10 days before things get pretty real for Congress. They are due to go home December 19th. So that's our last date for our last webinar this year. We're going to get you through what Congress is doing. And there's a lot that they have to accomplish within those next few days if we are going to make any changes to the Affordable Care Act subsidies, extend them and or do something different, and the federal, make progress on federal budget bills. There are so many stories out about what Congress may or may not do. And you can see kind of a popcorn potpourri of articles at the bottom here. Rather than try and go through each turn that's happening roughly every 5 minutes with Congress, the important part is whatever they do has to be able to get 60 votes in the Senate, 218 votes in the House, and it has to be acceptable enough to the president to sign. And right now, there is nothing that has been introduced or discussed that can get 60 votes in the Senate, 218 in the House, and Congress is sure the president will sign. Next week, there will be a vote in the Senate. They were originally planning on the 9th, and now it has been pushed to the 11th. As a promise to end the shutdown, the Senate said, we will vote on whatever bill you would like, Democrats. And the Democrats have said, we would like to just do a clean extension of the subsidies, keep doing what we're doing now for longer. That has been their position all the way through, and it has been voted down, I believe, 15, maybe more times. But now that we are much deeper into December, that idea of do what you're doing right now actually is the easiest path for states and others to be able to give some certainty to people who are shopping for marketplace plans. It is not expected to pass. There have been a lot of ideas tossed out kind of publicly about alternatives to extending the subsidies, some of which we've talked about in the last few weeks. There are some ideas that keep coming up, but there have also been some new ones that have come up this week. And the House was unable yesterday to finalize what it would put in a healthcare plan, and is said to be working through the weekend on pulling different pieces of ideas together into potentially one healthcare bill that it might want to vote on next week. There is not support for extending the ACA subsidies as they are in the House and the Senate. There are definitely members of both the Senate and the House that do not support extending the ACA subsidies in any way. There are also members who support extending them for a different period of time or making changes to the subsidies. The reality is next week, we're going to have a lot of different ideas, and we'll probably have to know what they mean, but there isn't agreement on what it is that they will do or whether or not they can get it done before the end of the year. In fact, Congress has been saying, even though the ACA subsidies expire in statute December 31st, they seem to believe that they have until January 30th to actually extend the subsidies. They are wrong. That is not the case. And January 30th, why is that date being plucked out of the air? Because that is the date when the current continuing resolution ends. So it is, in fact, the next pressure point Congress has on itself that it needs to do something. Otherwise, we're in a position of a government shutdown. So they are trying to portray that they have extra time when, in fact, that is not practically true for these reasons. First of all, people are shopping for plans now, and they have to make decisions with the information they have. And at the moment, the information they have is the subsidies are expiring, and this is what it will cost in the new year if that happens. There is no guarantee that Congress will do anything different than nothing. And there's no guarantee if they do something that what they do will in any way extend subsidies, or that if they do extend subsidies, that the rules will allow people to choose different plans in the new year. So people are really having to think about, what can I do and I afford now? And in many states, you have to pick a plan by December 15th, which for those of you who are counting is 10 days from now, to kind of say, hey, I want insurance starting January 1st of 2026. So that's the reality that individuals who are in the marketplace or are looking at marketplace plans are dealing with. From a state perspective, states know two scenarios for sure. They know, what does it mean to not have subsidies, to not do what we're doing now? And what does it mean if the things that we're doing now continue as they are? Anything that is not one of those two things means that states have to go back to the drawing board and figure out how whatever changes Congress has made impacts the plans that they have in their states and what the cost of those plans are. This is not an easy thing. This isn't just like change a couple numbers in a formula. It's hard and it's complex and it takes time. And there are some states that run their own healthcare exchanges that have to do all of that work themselves. And there are other states that, like Wisconsin, that rely on the federal health exchange. So they have to rely on the federal government to make those calculations. Not only do they have to figure out a new scenario, but they have to also communicate to every policy holder a lot of new information in a short time frame and let them know what they can do if they want to make changes to their plan or to the decisions that they may have already made. There were a couple articles now a few weeks ago that said, hey, if Congress just extends the subsidies as they are, states will still have to scramble, but they will probably be able to update the information that they have in time for plan holders to make a decision. That hasn't happened. So even the process of we've extended the subsidies and we have more certainty isn't it is still a problem states have to overcome. And anything that is different than that is even more of a challenge. And again, those articles that were saying states would really have to scramble are already backward in time. So we really are at a place where we've kind of passed the threshold of making it easy and maybe even past the threshold where this is going to be incredibly hard. And yesterday, some polling came out that says, yes, Congress's indecision is in fact having impact now. almost 90% of people who are in ACA marketplace plans expect that they will make decisions in 2025. And we are 25 days, 26 days away from the end of 2025 for their next year's coverage. About a third of the people say, hey, we're going to have to change plans from what we're doing now because we can see that we can't afford the premiums. And changing plans means that I have to change the amount of coverage that I can get. And it may also mean that I'm taking a risk of having to pay more out-of-pocket costs and have the plan cover less in order to afford those premiums. 61% of folks are saying the current situation, the current plan I have now, it's hard to pay for my out-of-pocket costs and it's hard to afford monthly premiums. And that tells you how many people are on the edge of being able to afford these plans with the subsidies in place. And about 2/3 are saying we can't afford even an increase of $300 without disrupting our budgets. So the other really big piece is 25% are saying we're going to make a decision to go without insurance because we can't afford it. And that's important because as we've talked about before, the way an insurance pool works is you need lots of people and you need many of those people to not need to use a lot of healthcare. So having many people who are younger or healthier in the pool who are paying in, but not necessarily having insurance claims is important to reduce the costs for everyone. And when younger, healthier people, about 25%, start leaving and going uninsured, that means that there are more people left who are the higher cost folks who are going to be using their health care more, and the prices go up for everybody because there are more people who need to use their plans and fewer people to kind of spread that cost out over a large number of people. Sometimes you'll hear that described as kind of the death spiral for the ACA. So regardless if people are leaving and becoming uninsured, or if they're leaving for different kinds of insurance plans that maybe don't have to provide all the coverage that's required under the ACA, short-term or catastrophic plans, or other options, like if they're leaving the marketplace, the people who are really struggling to figure out how do I stay insured are far likely to be older or people who have medical conditions where they can't afford not to be insured. And if all of those people are leaving, that means that you can expect to see costs rise again. Now, if the enhanced subsidies expire at the end of this year, that doesn't mean all subsidies go away. It means that subsidies go back to the levels they were at in 2010. And the enhanced subsidies essentially meant more people who earned higher incomes could get tax credits and money back at the end of the year. So there are people who will still qualify for subsidies. It's just that it will be a much smaller group of people, and those subsidies will be at the level of 2010. Healthcare costs have gone up in the last 15 years, and there are lots of very low-income people, many older adults, many people on fixed incomes, many people with disabilities, who will still qualify for the lower subsidies. But because healthcare costs have gone up, they still may end up with premiums they can't afford. And looking through the many articles that have come out in the last few weeks, there are lots of people where an increase of $50 a month is not something that they can absorb into their budget. So it doesn't have to be a huge increase in premiums to have more and more people, even people who still qualify for a subsidy, not be able to afford a marketplace plan. Congress has been looking for lots of ideas that are not extending the subsidies over the last week. Here are a few of them. We keep hearing about health savings account contributions being floated as an idea. And remember, when we were following the Medicaid cuts earlier this year, you kind of start hearing, if you start hearing the same ideas being repeated over time, it's a good sign that that is something being seriously considered. But there are also other things that are kind of being floated out in public right now. And sometimes members of Congress are testing the waters, or they're trying to, on an idea, trying to see if it hits and people like it, or they're trying to float something that they're going to introduce, hoping to get more support. All of these are kind of out there in the universe, even though there is no formal bill or language that is moving forward. Lots of times people in Congress will introduce a bill that they know doesn't have the support to pass. So what gets kind of cobbled together and included in a bill that actually will move forward is not necessarily any of, it could be a lot of different things. The health savings account idea does keep being repeated. And if you want to learn more about these accounts, there was an article out in the Washington Post that kind of went into some detail. These options already exist. They're used by millions of people, and you are able to set aside money that you can use for medical expenses. And I think if you don't use everything that you set aside in a year, you can roll it over. The best way of kind of talking about this is there's a place for a health savings account as a supplement to insurance, but it isn't a replacement for healthcare insurance. And simply having a lump sum given to you by the federal government doesn't necessarily mean, which is one of the ideas being proposed, is instead of doing the subsidies, why don't we give individual people a set amount, kind of like a block grant, a set amount to put into your account. There's no guarantee that that set amount of money is actually going to cover the medical expenses somebody has. And it certainly is not doing anything to reduce the cost of medical care or what people are billed. So lots of health experts are very concerned that an approach that only does this is really not going to help people who have bills be able to pay them, especially if they have ongoing chronic conditions and medical expenses, or they have an acute event, something that happens that's an emergency. You're also going to hear a lot of congressmen saying, hey, the Obamacare or the Affordable Care Act plans they're expensive. They're not affordable. Well, the reality is that everybody's healthcare costs are going up. It's easiest to see in the Affordable Care plans, but Medicare went up 9% this year. Medicaid, states have to decide every time what they are willing to pay. Remember, we had a huge increase in our last state budget that was a cost to continue. That cost to continue is the increased cost to do the same thing and provide the same level of care to the same number of people. So it isn't that only people in marketplace plans are seeing healthcare costs go up. That's true for Medicare, Medicaid, and employer-sponsored plans. Overall. And I think as you kind of are going to hear in the next few days, a lot of criticism about the cost of Affordable Care Act plans. Some of you who may have employer-sponsored insurance, your costs are likely to go up as well pretty significantly. And your coverage, what your plan coverage may be changed, and it might cover less and cost you more. So here are some things to ask Congress about what is their plan. If you're not going to extend the subsidies, are you going to extend the subsidies or not? And if you're not, talk to us about what your ideas are and how they are going to actually address the reasons healthcare costs keep going up. And here's a sampling of different, different aspects and kind of components of those questions. The other thing Congress said this week is, oh, maybe we won't do any federal appropriation bills. You might remember there are 9 appropriation bills left to do, and these are 2 that are pretty important to people with disabilities that have gotten pretty well through the process, and there's actually agreement on them. But the Senate isn't going to do anything about them until January. And that's important because the closer and closer we get to January 30th, the closer we are to that current continuing resolution expiring. And as you might remember from October, if this federal government hasn't passed a budget and they haven't passed a continuing resolution, then you are in a place where the government shuts down again. So that crisis state of either do the job of passing a budget, or you're shutting the government down, or you have to pass another continuing resolution is getting ever closer. And there is a big difference between a continuing resolution and a permanent 2026 budget. You may start to hear Congress members say, well, let's just pass a continuing resolution that will cover the whole year. That is not the same thing as a permanent budget. It essentially, a continuing resolution kind of means let's do things the same, except this administration hasn't interpreted a continuing resolution as constraining their ability to change how money is spent without Congress approving. So many watchers at the federal level worry that if Congress says, we'll just do a year-long continuing resolution, they are essentially sending a signal to the administration that some of the behavior we have seen over the last year would continue to be unchallenged by Congress in 2026. A 2026 permanent budget really does lay out, here is what Congress has approved money for, the amount and how it should be spent. And Congress has a lot more control about putting, some strings and requirements and parameters to make sure that the money that they are saying they want to spend is spent in the way that they intend. So here are some questions that you can ask members of Congress about the federal budget. And what they will do to make sure that the administration is not spending or changing how they're spending money in a way that Congress is not intending. There have been a couple of developments at the federal level in the federal agencies. Last week, the USDA secretary, and we've seen this pattern before, where maybe a administrative official or leader kind of says something out loud that gets coverage in the press, and they might walk it back a little bit later. And, it's kind of almost testing the waters to see a reaction. And sometimes those things happen and sometimes they don't. Or sometimes, they'll say one thing and maybe what happens is slightly different, but kind of in keeping with their previous statement. USDA leadership has been consistent about saying, we think there's fraud in the Supplemental Nutrition Assistance Program, which is food share in Wisconsin. And we think that because we are claiming that there is fraud in this program based on, data that has not been reviewed by anybody but us, that means we should change the program in ways that will eliminate fraud and likely mean that fewer people qualify for SNAP. So this article kind of goes through some of the things that that the USDA secretary has said in the last couple of weeks. But there is a regulation that is public now that would attempt to narrow who is automatically qualified to be in SNAP. And that is one change that is being made. It is not just a statement in the press at this point, and it does look like it would impact who qualifies for SNAP, and mean that there are some people who are in SNAP now who would likely not be after that regulation is passed. So the broad-based category eligibility really is focused on helping people who are in the Temporary Assistance for Needy Families, or TANF program, but it is not necessarily the only thing that the USDA might be considering if it is trying to find different ways to narrow who can get in the program, and justifying those changes because of a perception of fraud. This week, another statement that was given out was that states that did not provide the USDA with data, several months ago, we covered this, that the USDA had requested all of the information about everybody receiving SNAP, specifically wanting people's names and immigration statuses. And we've also been talking about how there's a growing and movement to marry many unrelated federal databases. And it looks like for the purpose of trying to figure out who is a citizen and who is not. And 21 states, including Wisconsin, objected to handing over their data because they didn't know how it was going to be used, and sued the Department of the USDA to not have to release that data. A federal judge agreed with the states and said, yeah, you can't withhold money from these states because they're not providing data that they're not legally obligated to provide. The USDA has not appealed that decision yet. It's still in effect. They could make a decision to appeal December 15th. But this statement, which is saying, hey, those states who have filed a lawsuit and haven't provided data, we are going to not give SNAP, we're not going to give you SNAP money for your beneficiaries, is a new development. And it appears to conflict with the existing order that the administration has not appealed. So stay tuned on that. This is yet another statement and movement that creates a lot of worry and confusion for people who are reliant on SNAP, and a lot of confusion for states. There's also been a lot of discussion about the rumored plan to eliminate the U.S. Department of Education, and specifically where to move or whether to move special education services out of the U.S. Department of Education into somewhere else. Nothing has happened yet, although we have kind of been aware that there's some plan that exists for quite some time. So this is a pretty in-depth article about why so many people are concerned about where special education and the expertise and the technical assistance and the oversight and civil rights enforcement ends up housed, and whether the federal government continues to do those functions. And for all of you who have been connecting with your congressional lawmakers over time, and some of you have been frustrated by responses or non-responses, I wanted to elevate this article because there are Republican members of Congress who are now citing constituent contacts, not only about the people at the Department of Education who have been fired, but specifically special education. They are saying, I don't know, I'm worried about what's going to happen to special education services in the department because of all those contacts. So for all of you who have been feeling like you're water dripping on a rock, sometimes those contacts that you make over time really end up mattering in not in the moment, but in many months in advance. And I think this is a good lesson about why it's important to always make sure that you are engaging with your members of Congress so that they know your concerns, because then at some point they may be able to be brave and talk about why they are concerned about the same issues that you are. There are some states that are moving forward with different plans that are looking at the oversight at the federal government for IDEA and saying, hey, there's too many people who have been fired already from the Office of Civil Rights. And that means that we don't think we can guarantee that the federal government will be doing a good job or enough of a job or a job at all when it comes to the rights of students with disabilities for public education. What can we do as a state to make sure that people still have access to IDEA? And there's two states that are considering state civil rights enforcement legislation for students with disabilities, California and Pennsylvania. So there's no movement in Wisconsin on those things, but I think that from an advocate's perspective, one of the concerns that many education experts and advocates have is that if you do return, a lot of money to the states and have no federal oversight, it will be up to every state to figure out what to do. And some states will maybe not do much, and some states will do something different. And that means that whether or not you get access to a free and public education may vary based on where you live, which I think a lot of advocates are concerned will mean that there will be some students with disabilities where they really don't have the ability to access schools or even contest treatment very well, and other places where that might be a very different experience. Lastly, the Department of Health and Human Services kind of continues to have a lot of discussion and work on vaccines. This is actually the title of the article from KFF. And it's important to just kind of know that there's been a lot of attention on the language that has been changed on various federal agency websites. And now that has also happened to the Centers for Disease Control, which used to have some very prominent information about how vaccines do not cause autism, because that, in fact, is what the body of research from the last few decades shows. The webpage has been rewritten in a way that kind of would lead you to doubt that there is scientific consensus and conclusions that vaccines and autism are not causal. And the other piece that's important, I think, for the disability community is the presence of autism this is part of a larger movement that is against all vaccines. This is an anti-vaccine message. And the idea that autism is a result or an outcome of vaccines that the department may have an ideological interest in changing is concerning, because again, it's using the presence of a disability and the desire to prevent that disability as a reason for an unrelated policy, to advance an unrelated policy on vaccines. We are going to continue to see the fallout from the reconciliation bill that passed in July coming to a head. And this will be more and more of a discussion within states about what to do. This article came out this week. It should be familiar to us because we spent a lot of time talking about, there are exemptions in the law for certain kinds of people. so that they don't have to prove that they're working. But then the question becomes, how do you prove that you're exempt? Or do you fit within the exemption category? And one of the categories of exemption is people who are medically frail or who have a serious and complex medical condition. This article goes into pretty big detail about all of the holes and unanswered questions about who fits into those categories. The U.S. Department of Health Services has not provided any guidance to states yet. They aren't required to under the law until next June, I believe. But states are trying to figure out, how do we design our systems, our prove your working systems and prove your exempt systems now. And this is a really big concern, not only for states, but like for people who have chronic or ongoing conditions. How do you know if you fit into that exempt category of medically frail? And how do you have to keep proving it? How often? How do you have to vouch for it? This is especially challenging if you don't have reliable access to medical care. And as many of you know, even having insurance doesn't mean that you can get in to see a provider on a schedule that conforms to the administrative requirements of a program. For a lot of people, they may be looking at booking out an appointment that may be a year from now, or 6 months, or even into 2027. So it becomes a real logistical question of, how do you understand who should be in these categories? And some of these things can be hard to prove. It won't be an easy thing for states to track. Another important resource that came out this week is specifically related to home and community-based services. They refer to it as home care in this article. These are all the things that are provided like under family care and CLTS and IRIS. And it's just another important reminder that Medicaid is paying for almost all of the home care work that happens in the country. 70% of the home care is paid for by Medicaid. And as a spending line item in the Medicaid budget, a third of the state's Medicaid spending is only on these things, on long-term care. Specifically, home and community-based services are optional under federal law. And we've talked a lot about how advocates are very concerned that the highest spending category that is also optional might be the place where states look to cut first if they have to save a lot of money to kind of balance their budgets. This particular resource shows you how states are already trying to control costs to limit spending on home and community-based services. These are all strategies that might be familiar to you because we've talked about them in these webinars many times, but states are already trying to, limiting who can get in. So, raising, say, the threshold or the eligibility criteria to get into a waiver is a strategy states use to serve fewer people or people with the highest cost, the highest needs. Many states set aside a certain amount to spend on a waiver and no more. That is actually how Wisconsin's CLTS waiver works. It's not a sum sufficient appropriation. It is sum certain, and they kind of calculate and project how many people they think will be coming into the program and what their costs will be, and kind of come up with a number. That's the same strategy also that is used with special education. So you can kind of see that if you get your estimates wrong, or if there are more people who need things, there are some people who won't get through the door. That's the purpose of that strategy of setting, here's the amount we will spend. It gives the budget some certainty, but it also means that it's likely that there will be people who need things who won't be able to be in the program. Sometimes they will not cap spending, but they will cap the number of people who can be in the waiver. And many states have waiting lists. States can also change what services are offered, decide to not offer things, or they can decide to have a service category cover like a greater range of things or fewer things. They can narrow or broaden what a service will pay for. And that's another way to control spending. And they can also change what providers are paid. And as we have already seen, there have been a number of states that have used reductions in provider rates as a way to control Medicaid spending. So this is a good article because it kind of sets the baseline of here's how states are controlling spending in specifically home and community-based services, which is a high-cost spending area now. And this is before the cuts to Medicaid come from HR 1. So what is it that we think that they could do to this specific spending area when we know that states need to save more money? And we do also know that in the past, when there have been Medicaid cuts, this has been the service category that has been cut first. There are lots of people who are specifically concerned about autism services, and this article focuses specifically on ABA services. Again, states are looking at this particular service because it is a spending line item that is high cost for lots of states. And my purpose you can read the whole article, which is really good and goes into in depth into, what states are looking at changing across the nation. But I think it's important to remember that when we get into a position where Medicaid is a high expenditure and the state is looking to make budget cuts and they're looking at what to do to reduce the amount of money they're spending on Medicaid, it will be tempting to kind of try and fight for each individual service. Don't cut this thing. Don't cut residential services. Don't cut ABA therapy. Don't cut chiropractic services. There are lots of different individual services that will all have, stakeholders who would like to continue to get paid for doing them, right? But for our group and our population, most people who are in Medicaid need more than one Medicaid service. And fighting to preserve funding for one thing may mean cuts to others. And it may mean that if you don't do your fighting right, that the services that are highest cost, that actually aren't the ones that people want the most, get preserved at the expense of much lower cost things that may end up helping people have more independent lives or being supported in their own homes. And I think that's really important to keep in mind because you're really, if you have a few services that continue, but the whole system isn't functional, that means overall a lot less care for a lot more people. And there are individual people who may rely on many services and end up with losing some services that are equally critical or more important, even as other things they use are preserved. North Carolina is in a situation already, largely because its state has not passed its budget for this year, and its state has already made Medicaid cuts in advance of HR 1 because of that. So, this is an early illustration, an example of how this could play out in many places. And I wanted to pull this quote because I think it is a really good reflection and way of talking about the breadth of care and services that are really critical and important to people with disabilities who are trying to live full and rich and independent lives. There are more and more things coming out about what states will be looking at in the next budget cycle. And HR 1, it has Medicaid and SNAP cuts. It also might impact the amount of money coming into states. So there's kind of two impacts. There's cuts to existing programs that are big parts of the state budget, but there's also a reduction in revenue coming into the state happening at the same time. And lots of states are already saying that the changes in HR 1 are going to create really big budget holes. None of that is news to any of you because this has been a consistent theme, for the past year is all of these changes at the federal level are actually handing problems to states that they have to solve later. The important part of this article, though, is that HR 1 is not the only thing that might put the squeeze on state budgets next cycle. The states have decided to spend money in a variety of ways: special education, transportation, higher education, corrections. There are lots of things that states do that are part of their state budget. There are also rising costs to do all of the things they already do across the board. And there is, as people, if the economy does not stay strong, if you have a dip in jobs, if you have fewer people who are earning, if income drops for people and they aren't paying in as much as taxes, those are all factors that are also ongoing in the context of big cuts coming from the federal level. This is a long way of saying the next state budget in Wisconsin is going to be really, really a battle. So we have kind of the next year to help educate candidates and people who will get elected to office about what is it that the state is spending money on and why is it important. But we also have in the year after they're elected, starting in 2027, that is when some of these big cuts that happened in July will really start coming to a head and impacting state budgets. KFF also came out with a valuable resource for states, specifically on work requirements. That is one of the components of federal HR 1. And Wisconsin people in Badger Care will be having to prove that they are working or exempt. So if you are interested in tracking what are other states doing and how are they making decisions, I think it's the intention that this will continue to be updated. Provider taxes, less of an issue in our state than many others, but yet another analysis of here is a specific restriction that was put into effect in HR 1 that is going to have a really big impact on most states' budgets and how they raise money, how they can get more money into their Medicaid systems. So this provision alone, you can see that the Congressional Budget Office has made some estimates that this will change how many people are uninsured and that it will reduce the number of people with Medicaid coverage because many states use this particular revenue stream to draw down and increase the amount of Medicaid funding available for people in their state. In addition, the SNAP cuts and requirements are going into effect essentially now in December. This is a pretty long article a couple of articles that explain again what are the changes in HR 1 and specifically highlight, there are certain states where if the system is already hard, all of these changes are likely to make it a lot harder. I think for people who need to prove they're working to stay in SNAP. I think the two things that are maybe relevant here are that currently about 1 in 8 adults are reporting that they've lost food share benefits because they had problems with paperwork. This is before we have tighter restrictions and more paperwork required for more people. So right now, for those folks who are trying to meet the work rules, they are saying there's a lot of challenges and bureaucratic snafus that happen, and it's costing them access to their SNAP benefits. They're also reporting that in the current system, there are people who have been dropped from the program entirely because of errors in staffing shortfalls. So one of the things we've been discussing over the past year is when you add more requirements, and more people have to do them, that increases the likelihood of mistakes, and it increases the risk that people will lose benefits because they either can't complete the paperwork on time, or the state system makes a mistake, or they don't have all the right documentation, even though they have fulfilled the requirements. People lose their benefits now, and tightening and making more people have to do those things increases the pressure on state systems and increases the likelihood that mistakes are going to happen and people fall through the cracks. And that will be the end for today. We are planning doing a webinar next week and the week after to kind of follow what Congress is doing. I expect there will be lots of ideas on healthcare Congress and then we will take a break probably until January, and come back.
All right, it looks like we had very few questions. We did have somebody ask a question about the DVR waiting list, so I put some information out there. We probably will talk about that more in the future. We are still gathering information for people who are maybe interested in that topic. As Jeremy said at the beginning, we're going to be having our webinar next week and the week after. Tammy will get the after message out once the recording is available. And I think that's it. We really appreciate you coming today, and hope you'll come back for the final two for December.
And for the person who asked the DVR question, we are trying to figure it out. And we are hoping that we will have more information and some action steps for people and clarity from the department next week. So we're on it. We just don't know yet.
We have talked to them and we've asked for some information so we can share it with all of you. So, all right, everybody have a great weekend and stay warm out there. Thanks a lot. Bye-bye.
Bye-bye.